authorities raising concerns about the decline, in fact, in the uptake of COVID-19 vaccines. It's as the country prepares to open for the 18 to 34 cohort to start vaccinating. That's meant to be from the 1st of September. Newzroom Afrika's Linda Mnisi joins us now live from a vaccination site in Parkhurst. And Linda, if some of the other reports we're seeing on social media, some of our own colleagues going to various vaccination sites also reporting that they've been empty. Is it the same picture where you are?
Well, Michelle, I'm at the Parkhurst recreational site, and this site has been pretty much packed. If you came here last month to take your COVID-19 vaccine, you would have seen the lines were long, but there has been concern raised by authorities saying that the uptake in COVID-19 vaccine is on a decline. You'll remember a couple of weeks ago, there was an increasing number in the number of people that are taking the vaccines. We're fast approaching the 300 mark daily administered doses. But if you look at the figures in the past 24 hours, it indicates that about 158,000 people have taken the COVID-19 vaccine. Now here, the line is really starting to grow. There are quite a couple of number of people that have started lining up. You'll remember that vaccine sites, Michelle, some vaccination sites start opening at around 7:30, 8 o'clock, and they start working. We've already heard some of the nurses singing inside, which perhaps could indicate that they are getting prepared to start working and start administering those doses. But you'll also remember the health minister, Joe Phatla, indicating that they're quite concerned as a ministry about these figures, also attributing it to the momentum, the growing momentum in the message sent out by anti-vaxxers, which perhaps is a challenge for the department in terms of how they've been messaging, the COVID-19 vaccine jab and the importance of taking the jab. You'll remember at the beginning of the administration of the 35 to 49 cohort, there was, of course, much enthusiasm, which one of the days where, the registration hit about 1 million, but that is dying down, and the department is not even done with that cohort. There are talks now that the department might now open earlier than expected for the 18 to 34 cohort, given the fact that there isn't, of course, many people now coming forward to take the jab, Michelle.
Yeah, in fact, the argument is that if you have not received a jab at this point, if you are indeed among the cohort that's able to get the vaccine, the argument is that at this point, everyone who would have wanted to get the vaccine would have already done so. I mean, Linda, insofar as what the challenge is for the health department now, insofar as active messaging around the COVID-19 vaccine is concerned, some analysts might say we're waking up to this challenge a bit late.
Absolutely, Michelle, and it begs the question of whether government got it right from the first time. They might have gotten it right with the non-pharmaceutical measures of preventing COVID-19. But of course, we've been experiencing the pandemic in stages. We're now at the vaccine stage. And of course, some experts were saying that they could have developed a message at an earlier stage. For example, government is using age to, vaccinate people in different stages and using age primarily as the basis because of course, how more likely people are likely to get sick from the virus or even die. So prioritizing, for example, those who are old and those with underlying conditions. But the messaging, for example, for the senior citizens, some experts saying government could have even used church leaders, could have gotten religious leaders involved. And now you would have seen the 35 to 49 cohort, they were the ones at the forefront driving this message, encouraging each other, even going as far as saying they will have, outfits to go out and get the COVID-19 jab. In fact, you remind me of a statement that was made by Khumbudzo Ntshavheni not so long ago, saying that government is preparing for the 2000s, the 18 to 34 cohort, the 2000s, the Amapiano, group. Those are the people that will be coming up. And the messaging there, it seems government understands who these people are, but there is no clear message to communicate with them on the importance of taking the vaccine.
Absolutely, Linda. Many holes in government's campaign. Linda Mnisi is our reporter live to us there as we continue to track the story around the uptake of vaccines. Joe Phaahla, the health minister, saying it's become a big problem. Linda Mnisi live to us there from Parkhurst, from the recreational centre there.